So let's talk about the mechanisms of hypertension after aortic coarctation repair. These all have to do with adaptations the body makes prior to coarctation repair when the heart and the left ventricle are pumping against the fixed obstruction of the aortic coarctation. So after relief of this fixed obstruction, you start to see unmasking of these previous adaptations as they return back to a normal baseline. The first two mechanisms that the body employs for overcoming the fixed obstruction of the aortic coarctation are remodeling of the left ventricle and adaptation of your baroreceptor set points. So the left ventricle is the main pumping chamber for the body, and when it's pumping against a fixed obstruction in the form of an aortic coarctation, it has to become hypertrophied and more powerful in order to sustain cardiac output to the lower half of the body distal to this obstruction. So after the relief of that obstruction, it takes time for the left ventricle to readapt to a lesser workload. And so this is one of the mechanisms for hypertension after a coarctation repair. Additionally, there are small organelles in the aortic arch and the carotid artery known as baroreceptors, and these sense the pressure in these arterial systems. And after coarctation repair, there is no longer a hyperpressurized ascending aorta, so these organelles, the baroreceptors which sense pressure, have to readapt to a new physiological baseline, and this takes a time period as well. Looking at the lower half of the body, we look at other organs that are perfused much better after relief of the fixed obstruction of the aortic coarctation, namely the adrenal glands and the kidney. So in the previous situation where distal to the coarctation there was lower body hypoperfusion, the adrenal glands and the renal system were making adaptations to maintain lower body blood pressures. Namely, the adrenal glands were secreting extracatecholamines in the form ultimately of epinephrine and norepinephrine, and the renal system was using the renin, angiotensin, and aldosterone system to maintain good lower body blood pressures. Now that there is restoration of good perfusion to the lower half of the body, the adrenal and the renal glands have to set themselves back to a new baseline in order to achieve equilibrium. So it takes time for these organs to reset themselves to a new physiological reality. In the meantime, we can control their blood pressure of this patient with nicardipine, nitroprusside, sometimes ACE inhibitors, and sometimes beta blockers in order to maintain homeostasis.